So hello and welcome to the second session of today's instalment of Interact Virtual Festival. This session is with Pete Trainor, who we're super excited to welcome back to Interact, although this time for the first time virtually. Pete is an author, strategist, applied AI designer, technologist, suicide prevention campaigner, and CEO of Vala Health. Pete is joined by some really special guests today, Tina Woods and Matt Eagles, who I'll leave Pete to introduce formally in just a moment. And in this session, Help Before We Need It, the ethics and pitfalls of designing healthcare services that know us before we know ourselves. Pete, Tina and Matt will discuss the future of data-driven predictive healthcare. And after an initial 25 minutes or so, everyone watching is going to be invited to contribute to the discussion with questions and opinions on the topic, so you can share your views if you're for it or against it. So yeah, please do join into the discussion using the chat or Q&A box. And yeah, please do say hello and introduce yourselves to each other there too. So yeah, without further ado, I will hand over to Pete to kick things off.
We're on. I'm going to do that classic. Am I on mute? No, I'm all right. Thanks, everybody. It's a bit strange. I've done Collaborate and Interact a couple of times, and I quite like seeing everybody. But I've got two brilliant faces in front of me, and that's all that matters. I'm just going to do a kind of a teeny introduction and then shut up a bit, actually, just ask some questions. So I'm Pete. I'm the CEO of Vala Health. My role at Vala Health is we're really trying to sort of move the business from healthcare into like preventative health services. So we're really fascinated in hallucinogenics. So that is the kind of cause of conditions rather than treating conditions itself. It's been a brilliant year leading Vala. We have just been kind of spending the last 6 or 7 months in the middle of a pandemic. So I'm a bit tired, but it's all good. Listen, there's so much going on in this space at the moment. AI and our health are becoming so intertwined. I think, we can all agree that there's a lot of stuff going on. It's being used to identify at-risk patients, predict issues before symptoms arise, potentially save lives. I've seen some fascinating applications of the technology in that space. I think collaboration between public and private sector, for example, is really leading to some groundbreaking new developments. And we're a private business. We're collaborating a lot, especially this year with the public sector, which has been fascinating. But, look, today we're here just to have a conversation less about healthcare and focus more on our actual health. Can AI help us live longer? Can it help us be better people? If we design AI for the long-term benefits of people's health, rather than as, just solutions to tackle the healthcare problem, does that empower us? Does it give us more information about ourselves? And I think that's one of the things that I'm really excited about my two guests and having this conversation. I've been seeing some really interesting applications of the technology for, AI that can cue triggers about your mood and ask you questions about your mood and help you really unpack what's going on in your day. I've seen applications of AI that really decrease the impact of trauma on people after, an accident, after something has occurred. Those are for my sort of input into the healthcare space, much more human focused examples. So, and those are the areas that really excite me. And those are the areas that I think my two guests are just so brilliant at. I think just before we go into the questions, I just want to say that, with this growth comes some incredibly interesting challenges. It's crucial that AI is implemented ethically and legally. And I think as an industry, we're really starting to grapple with what that means now. I'm really, really, really fascinated to find out some different perspectives on this one. And it's an absolute joy and a pleasure to welcome two people that I've met, since I've been working in the healthcare industry, that I've met at various things that I've got to know. We've got Tina. Tina Woods is the author and founder of Vala Health, and I'm going to ask her to introduce herself in a minute. And I've got Matt Eagles, who's up there on my screen. Hello, Matt. Who is the head of patient engagement at Links Havas. And I think I'm all right to say a patient himself. And he'll describe what's been going on in his life for the last umpteen years, but it's really fascinating. And both these people blow my mind. So I'm just going to ask you both just to introduce yourselves, and then we'll get into the actual topic itself. Tina, what's going on with you at the moment? What's your background? Why are we having this conversation? And welcome to this chat.
Thank you. And of course, Pete, I met you, I think, for the first time about 3 years ago. We actually shared a stage on AI and health. And I read your book on, you know, the humanity behind technology, which is so important. So, and really, and that's core to everything. I mean, I think that's the underlying principle of all of this, is that in the end, technology is there to serve humanity and make our lives better. So I wear a number of different hats, which is why I've been completely flat out busy for the last, 3 years actually, but particularly in the last year. But I obviously I'm here sort of, there are many people writing books at the moment, so I'm afraid I'm also one of those. But it really ties together, I think, my own journey over the past 3 years in particular, trying to really make sense of how technology will play an increasing role in our lives in terms of keeping us healthy and well. I'm really interested in that. And this is after spending many years working with pharmaceutical companies, which is a different side to the whole kind of healthcare equation. So my journey has been really connecting government, business, third sector, public sector in ways to really drive sustainable changes in health. I also run a couple of social enterprises, one of which is called Longevity International, which manages the All-Party Parliamentary Group for Longevity. So that's been a very interesting experience working with government in this All-Party Parliamentary Group. And over the last year and a bit, we have assembled to really develop the strategy, which we published actually in February, just before COVID hit, on how to increase our healthy life expectancy by 5 years while minimizing health inequalities. So that was published February, lots of fanfare, Matt Hancock supportive and all the rest of it, ties together the key things that we need to do to really deliver on this government manifesto commitment of the healthy life expectancy. So, and the role of technology and science and AI, I've been quite involved with working with the academic health science networks, NHS and also NHSX. So have been very involved in understanding and helping develop the whole ecosystem around AI and data-driven technology. So I've got a special interest in that. And of course, that has also come out as one of the core recommendations of Health of the Nation strategy. So with that, and over the past 2 years in particular, I've been so involved in this whole healthy aging. I've been working with UK Research and Innovation on the Healthy Aging Industrial Strategy Challenge Fund as well. So, you know, been very involved with that. And of course, so my understanding has grown exponentially over all the developments in science and technology in terms of keeping us healthy and well. So what I wanted to do with the book was really to kind of piece together my own journey and really understanding this evolving ecosystem. And fundamentally, it's about harnessing these technologies to really do the job of keeping us healthy and well, delivering on an improved healthy life expectancy. But very fundamentally, it's about closing the health inequality gap, which of course we've seen as a result of COVID being horribly exposed. So I'll stop there for now.
Amazing. And Matt Eagles, welcome, sir.
Thank you very much, Pete. Well, I don't know quite how to follow that, Tina. I'm a humanizer. I'm a positivity activist. I'm a possibilist. I'm a patient champion and a motivator. Really, I also have lived with Parkinson's for 45 years. So if you see me disappear off the screen to be replaced by a white bush, it really isn't me. It's my Parkinson's. Now, I've been invested in my health and I feel a sense of duty, if you like, because I've had such great care over the years. When I was 7, I was actually paid 50 pence. So I suppose that is in the doctors investing in my health to take medication. And of course, in 1977, when it was, 50 pence to a 7-year-old boy was a lot of money. And so ever since then, I've taken a distinct interest in my own health anyway. I really believe in uncovering the potential in everyone to improve health outcomes, not only sort of by democratizing health literacy and encouraging inclusivity. You know, I recognize the different expectations of all stakeholders, everybody's got a role to play in the future of their health. So I've lived with Parkinson's for 45 years, and I consider myself an expert in me. Not necessarily in Parkinson's, but in my own version of Parkinson's. And I had deep brain stimulation just over 14 years ago now. I don't know whether you can see them now. I've got 2 electrodes that coming out, they go deep into my brain, attached to a wire that goes down behind my ear and into a pulse generator in my chest. And ironically, AI can play a huge role in that. And Medtronic in particular, which I'm going to mention later, I've got a fantastic new product that's just been approved by the FDA. I think it was in July, which actually helps sort of predict brain patterns and what have you. But I'll get into that a bit later. But my real job, I raise awareness of patient sentiment by networking in as many sort of patient groups as possible, and I encourage meaningful dialogue between pharma, healthcare professionals, and patients themselves. So really, everyone gets the benefit. And so with regards to Pete, I like to humanize health.
Well, you are the perfect patient, is what I think, because I think a lot of people probably aren't quite as tolerant as you. Amazing. I mean, we're going to touch on bits of both your stories as we go. But Matt, I mean, honestly, I love catching up with you and speaking about all the stuff you've been through. And you literally are the bionic man. And
yes, I am. Yeah.
Wires and technology and things like that. So even when we hear about, Mr. Musk going on about neural link and all that kind of stuff, you've been doing it for 14 years. You're an innovator, my friend. Look, before we go kind of into the present and then a little bit into the future, I'm actually really curious to find out both your perspectives on the past. I mean, really, from your perspective, how do you think our health has been impacted over the last few decades? And that's going to just lead to another question, which is kind of, I'm interested to find out, because of that impact, if you think that technology is a kind of inevitability, that we need something more to deal with our health than the way that things have been traditionally done. How do we think our health is being impacted at the moment? Tina, do you want to go first?
Well, I would say, and I think COVID in a funny sort of way is showing this up to be the case. I mean, obviously we've got a pandemic that no one predicted except for Bill Gates 5 years ago. And suddenly we find that this pandemic is become a bigger disruptor than technology and aging demographic, which has traditionally been the two big disruptive forces that people talk about. And the one thing that COVID has shown is that people in poor health, and of course, age is a risk factor for chronic diseases, of course, but it's chronic diseases, it's coronary heart disease, it's hypertension, it's diabetes, it's obesity, that has put people at much greater risk of actually being affected by COVID and dying of COVID. What we actually have is a chronic disease epidemic in the westernized world. We have so many chronic diseases that are in the main lifestyle, in the main preventable. And are unfortunately linked to social inequalities. So this is the big challenge that we've got. And I would say it has gotten worse. I think I was at a very interesting conference yesterday called Metabesity, which is all around the whole kind of clustering of diseases, the chronic diseases. And what I write about in my book is how the underlying basis of these chronic diseases in the main is very much linked to the underlying aging process of cells at a cellular level. I studied genetics many years ago. I've got a very, very deep interest in genomics, genetics, epigenetics, the whole basis of disease and how we're influenced by our environment. So these are all the sort of things that I write about in the book through all the interviews, which I can come on to later, but it's exploding with knowledge and information now. But I think the way that, unfortunately, our healthcare has evolved and our health has evolved very much against the interests of us as human beings. We now have healthcare systems which are perversely aligned. They're all our cherished institution of the NHS, much as we love it, is very much geared around disease. And of course, that was why it was set up. It was set up to treat people who were in need of most help, to treat them when they were ill. And that is still very much how it's set up. It is completely driven by activity-based metrics. Prevention is not how it is designed. And we have, unfortunately, a number of industries that perpetuate our ill health. They have an interest. If you look at the food industry, junk food, processed food, again, going back to a session yesterday, we had a person from Kazakhstan who was talking about the nomadic traditions of how their ancestors who used to walk, they used to go through periods where they couldn't find food. They went through effectively enforced intermittent fasting, which, by the way, is one of the tools to help you keep young, is actually not eating for periods of time, because it then puts your body into a state of getting rid of all the junk, the toxic stuff in your body. So that actually is a strategy for aging well. But it links back to how we used to live. Rough food, grains, roughage, fiber. These are all the things that are missing from our diets. Junk food, processed food, which is cheap food, which of course drives margins in the food industry. Sugary drinks, we are addicted to sugar. We've now got legislation, and unfortunately, much as we need very good treatments from the pharma industry, and I'm not saying that otherwise, but unfortunately, a lot of their business model is around chronic diseases. So they, that perpetuates the cycle. And you only have to look to the US, unfortunately, which spends, double of their GDP than most other countries. And yet they have a decreasing life expectancy because they don't move around. They eat a lot of junk food. Death by despair, the opioid crisis, because people are, don't have hope for the future. These are all the things that actually are a drag on our health. So I'll stop there. But so unfortunately, I think there's a lot of rejigging, a huge system change that needs to take place, and hopefully COVID, the one silver lining, it'll be a trigger for some of that.
Yeah. And what about you, Matt? Do you think it's all, we've been impacted quite positively?
I think, well, as somebody who suffers from a chronic disease myself, which is actually largely man-made due to, or many versions of it are largely man-made due to chemicals like paraquat being used on crops. I think it's people's understanding and education on these kind of diseases that's getting more prevalent. But also, I know particularly the next pandemic is, well, if it's not here already, is in Parkinson's, simply because of the environment that we live in. And actually, I do have, I'm not trying to promote this book in any way, shape or form, but this book, Prescription for Ending Parkinson's by Bastian Bloom, is a very good insight into exactly what is happening in our world. But going back to what's happened, how health was before. I mean, I used to fill in charts on this old, I don't know if you can see it on this type of graph paper, but all those records have been lost since digitization, which is all very well and good having electronic health records. And I'm going to do something which I've not done before, actually. I'm going to actually read you out my GP summary, just very, very briefly. It says, 1st of December 1968, adopted. 7th of November 1975, which is in fact my 7th birthday, Parkinson's disease. 1st of January 1977, Parkinson's disease. And then we leap 21 years to the 22nd of October 1998, intramuscular infiltration of botulinum toxin. Now, that to me isn't necessarily an improvement. It just shows a loss of decades of medical information that could help in my future treatment. And that's just one example. Is that the same for everybody else? I don't know.
Yeah, that's really fascinating. So actually, one of the things that's impacted the past is, Tina's pointed out, is our lifestyle is a big issue. And even at Vala, we're doing less primary care appointments at the moment, even during COVID, and doing a lot more lifestyle related appointments, diet, that kind of stuff. But actually, Matt, to your point, the digitization of everything in the last 2-3 decades or whatever it's been, is making the invisible visible, but anything before that is kind of gone, which is really fascinating, and especially if we think of data and AI, because what you're saying is that we're learning quite a lot about people on quite a small record set of
exactly.
There wasn't anything, pre 20 years ago. Amazing. And then just that leads actually really interestingly into the next question I'd written down here, which was this perspective from you about, so does data and the power of algorithms, to process data really significantly increase our opportunity to create personalized healthcare, which I think, or personalized health outcomes, which I think we already know about, but also, do you think it's creating a way for you to be able to manage your condition and your health in a way that's been truly revolutionary to you in the last couple of years?
Want me to answer that?
You can go first, Matt.
Okay, sorry. I genuinely think it does. I think having, say, electronic health records everybody can access, for example, would be a brilliant idea. In other words, having a ledger of your own health. If you blockchain it, for example, then everybody can see the same records. There was nothing more frustrating. The number of times I've been in hospital, and sometimes I've had Parkinson's 25, 26, 30 years. And I was getting questions like, so how did it all begin? And it's one of the most frustrating questions. Now, if they'd had my record in front of them and an electronic health, they'd have been able to see the records. So for me, data is super, super important. And the sooner we can get it installed as an everyday sort of thing, the better for everybody.
Interesting, because you're saying it's not at the moment, which is really interesting.
No.
Tina, in the book, you spoke with a huge volume. I'm really excited about the book, by the way. A huge volume of experts in this space. How often was personalization the kind of resounding topical theme in improving health outcomes during all of those different conversations?
Yeah, I mean, personalization, truly personalized medicine and truly personalized health is obviously a massive opportunity. Whether we've got it, in reality now, right now, is obviously different because, there's, and just, looking at Matt's experience, I mean, I still don't even have my own patient record. I have tried to kind of find it. I know I've sent a few emails to my GP. I still do not have access to my own personal health record. And I think, and the data shows that people who do have access to the health record, and there's quite a lot of research in the States, show that actually their health outcomes improve. Now, part of the reason is because they can also fix mistakes that are there in the health record. And, if you take an active interest in your health, and certainly someone like myself, and certainly with Matt, when we are going to different doctors, and yes, to Matt's point, it's very frustrating when you have to retell the story, and I'm sure with Matt, it must be, completely infuriating. But if you're the one actually making the connection between, yes, I saw that doctor, yes, I saw that doctor. I mean, I had a problem with my right foot, and it turned out to be some sort of neural fibrous mass, and it had to be dealt with a steroid injection. But the amount of people that I had to see and the amount of talking over and over again about the history, it was just so frustrating, and it took months, when it could have taken literally a day or two to get what I needed, which I knew because I had suffered from it before. So just the sheer inefficiency at the moment, because we don't have access to our own health information, is just mind-bogglingly ridiculous. So, but just going back to the opportunity of data and AI. So the big opportunity, now Matt had mentioned, this gaping kind of, period where there's no data being collected. Now we know that, one of the big opportunities is being able to mass collect data, so that at a population health level. And of course we have, ways to protect privacy. There's all sorts of incredible privacy preserving software. And you mentioned blockchain. I mean, there's all kinds of ways that we can actually safeguard privacy of individuals. But when you have that gigantic amount of data, and I would say the biggest issue there, going back to the ethics and the things that people worry about. We know that data bias is a massive problem. So you need to make sure that whatever insights that you're collecting from this access to data, and you have to make sure that it's representative of the pool of people that you're developing technologies for, so you're reducing data bias, for example. You need to make sure you're getting your hands on the right data. All these sorts of things are implicit assumptions, to get the right data, to understand and get the right insights, to develop the right technologies and the tools to be able to eventually develop very personalized tools for your own health, and obviously at a population health level. But there are extraordinary developments. I mean, in genomics and all sorts of tools and strategies that can give you personalized, recommendations. I would say a lot of them are still, it's still a bit of a wild west for a lot of them, and some are good and some are bad, but a lot of it does come down to just getting access to the best quality information possible on the widest possible number of people to be able then to extract and use AI technologies in the best possible way. I mean, there are exceptions to this, of course, but in the main, that's kind of where it's headed. So just to your question about, personalization, yes, that has been an ongoing theme in the book. And of course, a lot of what I'm very excited about, in terms of living longer and more healthily and all the rest of it, surrounds this incredibly interesting space in research at the moment, which is the underlying basis of the aging process, which, as I mentioned earlier, is at the heart of a lot of the chronic diseases that we're suffering from, which are, and I think it's all the things that we have control over: what we eat, our fitness, how we sleep is a big one, our stress levels. Now, some of that we might not be able to some of that's imposed stress. Matt mentioned the pollutions and things like that. Some of these are imposed on us, but there's an awful lot that we can actually do to change our circumstances. I write about the exposome in the book, which is the environmental influences on our genetic expression. We are given our lot from our parents. And Matt, I think you said you were adopted. So I don't know if you have a sense of, where at the root of, your own Parkinson's disease, etc. But of course, polygenic risk profiling, being able to understand, where we might be at risk of disease. And for example, Alzheimer's, some of it is heritable, a lot of it is not. Actually, it's very, very lifestyle driven. There's an enormous lot you can do. So developing that personalized understanding of actually, what genetics you've got, what you can do epigenetically, which is influencing the expression of your genes. This is where the environmental impact is so interesting, and many of which are in your control, is absolutely fascinating. Microbiome is the next big thing, and that's, the gut health. These are all, in fact, gut health, microbiome is the next big thing. It's they're understanding more and more. In fact, it's even more important than they probably, it's the most important. Of course, it's linked to mental health and depression. I mean, it's just gigantic what they're finding out at the moment in the microbiome space. But so yeah, the tools are getting better, but it's still kind of early days for a lot of it still, because it's just exploding, and obviously multiple AI, spotting patterns between different data sets that we can harness, is the next big thing. But yeah.
So, Wild West out there, Matt. You've got your hand up.
Yeah, I have. Yes, it's force of habit. I mean, the need for personalised medicine, I don't think can be highlighted more than in the diseases like Parkinson's. How can you have medication that is efficacious for an 8-year-old and an 80-year-old? So say I began on my journey on Cinemat. Now that's obviously something that somebody who, I mean, how would that affect me in comparison to a lady of Black African origin who's on a menopause? Because people do get Parkinson's. How? So you just can't. I mean, it just baffles me why, if you Google Parkinson's, you get the image of an old man and it's over 200 years old. How does a Black African lady in her mid-20s feel when she looks up for what she should do to help herself, and she sees an old stick man who's over 200 years old? It just doesn't equate to that. That, to me, if there's ever an example of a need for personalised treatment and personalised medicine, that is Parkinson's has to be a prime example.
Yeah. Yeah, it is fascinating. I mean, it is. I think a lot of designers and people building technology and consultancy firms and stuff that kind of jump into healthcare because that sounds cool. Like the complexities of our health are almost unfathomable, and so having tools to help us make sense of it all is just phenomenal. We're going next year. Vala are going into the epigenetic space with a partner company so that we can provide more personalized health outcomes. But we, you know, it's taken us a year. We're going to go into this really slowly because it's incredibly complex, and the ethical pitfalls are getting us wrong. Which is actually a question I had written down here, which I was going to really fascinated on your opinions, and we've touched on it a bit. Is, you know, I think with the tools that are swirling around at the moment and the tool sets that seem to be, you know, democratized and get everybody, you know, building in their bedrooms and stuff. And because data poses this massive opportunity to improve the efficiency of everything that we've been talking about, you know, is there also an ethical risk of data and AI tools being implemented and imposed on us, which include, you know, obviously threats to our privacy, confidentiality, blah, blah, blah. But, you know, what do you think are the threats of these things just being put out there to give us better health outcomes, but without the consideration of the what ifs? Tina, do you want to go first?
Yeah, I mean, it's such an important question, and actually the UK is a real leader in this space, and I have to pay tribute to my colleagues who actually I've been working with, you know, at NHSX on this, who spend a lot of time developing the code of conduct to address exactly these sorts of issues. So, you know, the big thing, you know, in terms of we want to use, you know, we need to use AI that's safe, that's responsible, that's ethical, that doesn't leave anyone behind. So these are sort of like some of the basic principles. So I've been doing work with my colleagues at the Academic Health Science Networks and also NHS and NHSX around this whole sort of field. And actually some of the worries actually came out very strongly. We did a big report that was essentially did a baseline analysis of some of the key opportunities, but also sort of concerns and gaps and so forth in terms of AI in health and care. And the ethical side, you know, was one of the big areas that needed to be tackled. So the code of conduct was an opportunity to address all that. And the sorts of things, so there are 10 principles behind the code, and it's very much seen as a leading piece of work in the world, actually, in the health context. So some of the core principles, so there are 10 principles. So understanding user needs is absolutely core to this, to really understand, you know, and defining the outcome of how the technology will contribute to this. Using the appropriate amount of data, so, you know, not going overboard, and being very clear on the intended purpose of the data. Being very transparent about what the data is going to be used for. And the other point is also about this openness, you know, making use of open standards, making sure that, you know, from an interoperability point of view, it can essentially interlink and communicate with other systems. So again, it's about that sort of transferability and access point. Being very clear about the limitations of the data being used and the algorithms being deployed. And a few other sort of areas like, you know, evidence for money, things like that. But so very, you know, so in the end, it's very much around making sure that you're really clear about the use. Of course, things like data bias are inherent in terms of, you know, really understanding what data you need to be able to get the right insights. So I think, you know, of course there are risks. I mean, I think going back to sort of, you know, risks, I think, you know, and certainly from the COVID perspective, I think one of the biggest risks as we're moving increasingly online is creating an even bigger digital divide between the haves and the have-nots, because some people don't even have internet access. Some people don't know how to go onto a Zoom call, for example. You know, if you need to speak to your doctor remotely, if you're in, you know, shielding. I mean, these are the sort of these are some of the biggest risks that we've got at the moment. These pose deep ethical concerns right now.
Yeah. Yeah, absolutely. I mean, I could talk about that one for ages, because I'm a CEO of a telemedicine platform, and actually the people we want to reach are the most unreachable.
Absolutely. The ones who need the most help.
Exactly. The irony is ridiculous. Matt, what about, have you got a perspective on kind of patient safety and care?
Yeah, I have. It's a tricky one, really, because I'm quite blasé about giving my own information out, and I think I'm quite as you probably heard from reading my notes out, I think I'm quite unusual in that fact. I feel because I've had my condition for so long, I want to share my knowledge and my journey with as many people as I possibly can. But for people who are either newly diagnosed or haven't had a condition for as long as I have, there is definitely a reluctance and a suspicion to what's going to happen to my information. Is it going to happen like on Facebook where, I mean, I find it quite astonishing sometimes when on social media, I mean, I'll give you a bizarre example. My son began having boiled eggs for his breakfast. And all of a sudden, and I'd never searched for egg cups or anything, I started getting adverts on my Instagram account for egg cups. Now that to me, it sounds super clever or super creepy. One of the two.
I mean, well, that's a whole other topic. If you haven't seen it, watch The Social Dilemma. It's very, you know, it's very Netflix, but it's just fascinating. We've all experienced that one at the moment.
We have definitely.
Because I think what you're describing is the difference between care and creepy. That's going to stop people adopting the kind of technology that we're really excited about people having access to, is if they think it's creepy.
I think you've got to look at the individual nature of physicians and the patients themselves. Now, I mean, I kind of wrote an article actually in advice for clinicians, how to keep patients involved in what matters in the age of AI. And you've got old school authoritarian clinicians, you've got caring and supportive, intellectual, analytical, inquisitive, bureaucratic. But I mean, they're not mutually exclusive, those traits. But I think you've got to look at the different personalities as well. And if you look back in sort of, well, in many respects, not that long ago, you've got patients who will accept anything, and not just patients, but I think it's Maoris as well in New Zealand. Well, that the physician is very much revered, and everything they say will be taken as gospel. So I think it depends very much on the person's personality, which is why it's so important to humanize that, I think, and get. I mean, I suppose with you, Pete, with Vala, it's important to get a physician and a patient who actually get on, maybe.
Yeah. I feel like my job at the moment is running a dating service.
Yeah, well, it's a health dating agency kind of thing, isn't it? Really?
Yeah, and it does feel like that sometimes. And actually, that feels like the most important thing we can do is connect two people in an incredibly efficient way. The best health outcomes from that are, you know, if you trust the person that you're talking to, you know, the health outcomes will be beneficial. So I'm completely with you. I've got a couple of questions popping up, but I've got one or two more, which I'm really fascinated about. It's such a broad topic. Like, what from both your perspectives, Tina, from your perspective first, you know, have you seen or heard anything that's really made you go wow over the last couple of years, or in your kind of research for the book and stuff like that? In terms of,
there's so many things. There's so many things that are just wow. I mean, what I would say is what is the most wow is just the sheer explosion of stuff that's happening at the moment. I mean, and I'm talking, so obviously my area of growing expertise, I guess, but it's just so vast, I'll never be an expert, but is this, again, going back to the whole understanding, you know, how we age, and the fundamental link with diseases and all the rest of it. There is so much phenomenal work taking place at the moment by incredible scientists, many of who I interview in the book, which are literally all there to essentially, quote unquote, well, some of them want to make us live forever. Well, and I would say, well, I'm not so sure I want to live forever, but the fact is that the pace of acceleration, technology, and understanding is getting to the point where potentially we will get to that point there are concepts like longevity escape velocity that literally, because of the sheer explosion of research taking place at the moment, we will figure out quickly enough so that even us, by 2045, they're saying that we will be able to unlock the secrets of aging and be immortal. I mean, this is how fast the pace I'm not so sure I quite believe it will happen at that point, but there are certainly quite a few people who do believe that very soon we will be able to live to be at least 150 in our lifetime. So, and that is down to, and this is where AI is absolutely the tool that is allowing us to do that. So I think in terms of my wow, it's if you Google aging biomarkers, so it's all the biomarkers or markers, and there's obviously digital markers, there's behavioral, there's all kinds. But this is where AI, by understanding and spotting the patterns between all these markers that are all indicators of how well or not you're aging, and this concept of biological age, which is a measure of your internal health, like really how healthy you are, which may not match up at all to your chronological age. So if you're really healthy, your biological age based on these biomarkers will be below your chronological age. So understanding that, and of course all the technologies around that. So one of the mind-blowing developments, which you can look up because it was talked about last week at my launch event for the book, Alex Everonkov, who is one of the people I interviewed. So he is probably the leader, or certainly one of the leaders in AI-driven drug discovery, but also in aging biomarkers. And they have developed an app which can take a picture, a selfie picture, and of course, how your wrinkles and your physical appearance on your face, is an indicator of how well you're aging, because people who drink and smoke, tend to be a bit more sort of wrinkly and all the rest of it. But then adding in some other biomarkers, it can give you, and this is through an app, can give you a very specialized readout of your biological age, but more than that, your own strategy about keeping young and fit and healthy, and either increasing, sort of decreasing your biological age if you need more help. It's your personalized kind of longevity strategy. So this is because of all the stuff that is going back to again the genomic side, understanding how your body interacts with the environment. So and AI is driving access to the literature, because and actually spotting the opportunities in the scientific community, but also making use of that information, spotting the stuff that no human would ever be able to spot. And this is where the connection between this vast array of biomarkers. So this is an interest in the neurodegeneration space, and in the disease like Alzheimer's. This is what we'll find. Certainly what's going to putting you at risk of dementia, but also more interestingly is how you can minimize, delay, or even stop dementia. This is actually going to be possible because of all this research, and this is absolutely mind-blowing. So Alzheimer's Research UK has done a big deal with Bill Gates, on this big project, which is all around understanding digital fingerprints, what puts you at risk of dementia. So, we are getting there, and this is amazing. This is fantastic.
What about you, Matt? Have you seen stuff that's, or have you used, consumed, been subjected to things that have made you go, wow?
I have actually, yes, and ironically, I didn't get it inserted in my chest as I wanted it to. It's
that's a leading statement, isn't it?
Yes. No, I actually did some testing work on a Percept. It's called a DBS Percept, and it's for Medtronic, and it helps in controlling epilepsy, dystonia, Parkinson's, essential tremor, and I think there's several other things as well. And it basically enables you to correlate the brain signals inside and outside the clinical setting, and it captures the events. It can take medication, symptoms, or side effects, and it enables you and the clinician to deliver personalized, data-driven treatment. And I was really looking forward to having it in my chest, so it could learn about my brain signals and which ones worked and which ones didn't. But unfortunately, due to red tape in the NHS, I wasn't able to have it. But I have another. It's bizarre, but it kind of learns which the best signals are. So you can put, and almost automatically goes to the right settings. It's phenomenal. And if you actually saw me with this device switched off, I literally cannot move at all. I can't do anything. I can't even crawl on the floor. I'm a zombie. But the strength and of this DBS. I mean, when I was having this to really humanize it, when my physician was altering the stim, my eyes started to droop as almost if I'd had a stroke. And he said, "Are you okay?" I said, "No." And the whole other side of my face was paralyzed. And he said, "Okay." And he just switched the settings around and it was back to normal. And I was, well, hey, this is brilliant. And if a device can learn that through artificial intelligence and machine learning, then that is phenomenal.
It's amazing. That's amazing. It's, I mean, I'm on the fence of fearful, even though I'm in the industry. Like, I'm terrified of it. And I'm also, I think, the regulation of all of this stuff is quite incredible, but the brain is such a complex device. I think the irony of having algorithms translating the brain is kind of there. Do you know what I mean? Like, there's so much parallel, and I think if the machines are designed with humans in mind,
I think it's incredibly exciting.
Yeah.
I mean, I can't emphasize how much it would mean to, particularly to patients in the epilepsy spectrum, in neurology in general. Brilliant.
Amazing. I think one of the things, just really quickly, and then I've got one more question and a few from the people watching.
Yeah, sure.
I mean, do you think there's going to be an over-reliance on this kind of technology? Or is it a kind of inevitability now? Is there an over-reliance on the algorithms to decipher what's going on in X, Y, and Z for our health? Or, feeling pretty optimistic about it? Tina, what do you think?
I don't think there is at the moment. I would say, I mean, obviously we've got our enthusiasts who are doing all the, got the Fitbits and the Garmins and the smartwatches and all the rest of it. But I kind of, the parallel that I see, and I guess what we have to be mindful of is, how we had all the tom-toms and the sort of, the navigators, when you're in your car and all the rest of it. And then of course it's all on our phones now and all the rest of it. I think there's a danger by being too reliant on it. I think you still need to learn how to read a map, and you still need to know where you're going. Yeah. Because, you've heard about the stories of trucks falling off cliffs, things like that, or getting stuck on these tiny lanes because they've been too reliant on this technology in terms of navigation. So I do think, we have to remember that the tools are meant to augment, our own intelligence. And I think we're still a long way yet before the machines will completely take over our lives, and I think really where it's at now, what I'd say is that the good place to be is to make sure that we can harness technology as our friend to enable us to live as good a life as possible and to care for our communities and other people who are more vulnerable. That's really where, and that's obviously what drives me and what motivates me to kind of get to grips with this technology. But I'll just tell you a little story, which I actually wrote about in my book. So I felt, I write about health innovation all the time. And then I took a good look at myself and I said, you know what? I don't even have a smartwatch. I don't use any of this stuff. I'm such a fraud. And I've got to get myself a smartwatch and get to grips with this thing and really, teach myself how to use all this stuff. So I got this smartwatch as a present for my 55th birthday, the Series 4 Apple Watch. And and then of course I was so busy and I was like, okay, and of course some of it's very intuitive and I kind of got really excited when I realized when I was on my treadmill that I could actually dictate a message back to my son on WhatsApp rather than having to, text that myself, and that was all very good. And I loved having it be able to ring on my wrist, but actually using it for my health, I was not using it for my health until the pandemic struck, and I was like at home and I'm sitting in my office all day and I thought I've got to keep up the physical regime. So I thought, you know what, I'm just going to start using this flipping smartwatch because I got my Spotify working, got my music on, I could go out. I hate running, but I was going out. And then I realized, and I was very, very intrigued by my base heart rate and then, how fast and how fast I was going by running. And then I realized, oh my goodness, I can, see if I've got atrial fibrillation and all this sort of stuff on my smartwatch. And I started to engage with it, but it took the pandemic to get me to use my smartwatch. So, you know, and now, of course, I use a fraction, of course, you can use it for, but I am very intrigued about, and I think it's this information is power and knowledge, and it can get you engaged. And I think that's the point, and you can use it as your friend.
Yeah, that's I mean, that's brilliant, because a curiosity in our health should be the driver for innovation, rather than innovation driving a curiosity in our health. Do you know what I mean? Or maybe the two things.
Yeah.
What about you, Matt? I mean, are you over reliant on technology to manage parkies, or is it?
I think if I switch my DBS off, I guess I am. Yes, I wouldn't be able to move. I like tech. I love it. I mean, when I think how, I mean, just when I had my DBS operation 14 years ago, I was in hospital for nearly 3 weeks. Nowadays, you're in hospital for 2 or 3 days.
Wow.
If that. This is how rapidly tech and AI and these kind of are actually accelerating. And I think I think I might be answering Simon Norris's question right now, but COVID has really encouraged people to care about their own mortality. Mm. So the uptake of digitized health apps and what have you has been huge. And to answer Simon's question, I think this is why partly why there's been an explosion in the number of companies getting into the space, because people care now. People thinking, oh my goodness, I might die. Mm. And what can I do to to live longer, for want of a better word? So they're taking health seriously.
Yeah, that's awesome. So Simon's question, for anybody that can't see it, is, you know, what's driving the explosion of healthcare companies? And Matt, I think that's a really good one. And it takes sometimes I know COVID's not a black swan event, because it was.
No.
But, you know, it takes an event to shift people forward. Do you know what I mean? It took a banking crisis in 2008 to, you know, kickstart fintech. It took, you know, maybe it's taken a pandemic to really kind of get us interested in our health again. People know how to use a QR code now, and it's taken 15 years, because you need to use it to, you know, check into restaurants and things like that. Tina, what do you think is kicking the sort of explosion of healthcare companies? Why has it become a thing right now?
Well, I think Matt just hit the nail on the head. I think the fantastic thing about COVID, however horrific it has been for so many, and of course the people who've died from it, is that it has completely focused the world on health as our greatest asset. And again, and this is actually fundamentally what funnily enough, with my book, for example, it was supposed to come out in April. So that would have been at the height of the pandemic, actually, in the height of lockdown, all the rest of it. So actually we delayed publication till last week. And actually the book, I think, is much stronger as a result, because I've obviously had to pivot the book away from it, but actually what came out of it and the whole experience, this whole business around health being our most treasured asset in the world, and actually is fundamentally linked and will be linked to our future prosperity. It's completely linked with health and wealth, are absolutely fundamentally interlinked. And actually, you have to, the tragedies that we have seen, the fracture lines, you know, that we have seen exposed because of COVID, have been to do with the inequalities in society, which are obviously linked to health inequalities. So that's a fundamental thing that we really have to get right moving forward. So I think that's a big test, I think, as a world, and the leaders in our world, to kind of get that balance right. But I think, but going back to the point about health, I think, you know, clearly technology can have a huge role to play. And one of my last interview actually with the book, and I was very lucky to interview him, and I have a whole story about that. I was in Singapore the week before we launched Health the Nation strategy, which I mentioned earlier. I was invited to speak to the Singaporeans about the work that we were doing. Actually, they're very interested in the work. And that was when they had just they were just facing the COVID thing themselves. So I was checked at the hotel, you know, temperatures, and I was given a goodie bag with my hand sanitizer and mask and all the rest of it. And then came back to Britain. I'm like, oh my goodness, you know, and then we had the launch. And then of course the following month was lockdown. But I had met, while I was in this conference, Professor Peter Piot, who's the leading world virologist. In fact, he sits on the EU advisory board for COVID-19, and he's director of tropical, this London School of Tropical Medicine Hygiene. I arranged to see him in March, and this is just before we knew what was going to be happening with COVID. And then my appointment got rescheduled from his office. And I thought, oh yes, because it's COVID. And of course, he's now on the commission. And of course, he's very busy. But it turns out that he had come down with COVID himself. And he talks about how the virus has got their revenge, obviously, because he had discovered Ebola and had been world leading in the AIDS fight and all the rest of it. He actually suffered really badly. And of course, we now have this thing called long COVID, the after effects, and it's all linked with chronicity symptoms and all that kind of stuff. So I interviewed him eventually a few months later, and he had this whole story. And what he says, the key takeaways, and I'll shut up in a second, was, the key lessons from COVID is we need to be ready for the next one, because there will be another pandemic. We need to act early. And of course, we're seeing now what we have lost as a result of not acting early enough, which other countries have done, like Taiwan, for example, and of course, dare I say it, China. But most importantly, health. We need to be in good health. Preventative health is absolutely fundamental. We have to see this as a big lesson.
Yeah, absolutely. I don't think I could have thought, summarised it better myself. And in terms of health and us taking responsibility. It shouldn't be the responsibility of an algorithm or a national health service or whatever. We've all got to take responsibility for the outcome of the next one. Yeah, really fascinating. I've got one more question, and then I think we're sort of wrapping up very shortly. We could do this for hours, let's face it.
There's a great question in the Q&A, by the way, Pete.
That's the one I was just about to ask about. But it's a loaded one, and this could be an hour's conversation on its own. So we'll try and do this quite quickly. Someone's basically asked a question about a relative with MND, motor neuron disease, who was not recommended, who was not told to shield by their GP. So their GP did not tell them to shield. They're obviously in the vulnerable category. Because the systems, I'm assuming the systems in place were not linked in any way. So no one's designed the ecosystem of all the different faculties and departments to know that this person should not be going out to their clinic to get their treatment. How do we think this could be improved is the question at the end of the kind of the story. How do we link up healthcare systems in 1 minute?
Go on, Tina.
Well, I think this is such a fantastic example of systems not talking to each other, and a fantastic example of the huge potential and opportunity we have if we get systems to talk to each other, if we get data sharing right, interoperability right. And so just very quickly, this is some of the work that is very top of mind. I know because there's a national data strategy, there's a whole bunch of work going on, and that national data strategy is closing on the 2nd of December, the consultation. Health and social care data strategy is just in the process of being released. And of course, there's a massive attention on how we can enhance data sharing so that systems can talk to each other better. It's our biggest problem, but it's also the biggest opportunity. So I think watch this space, because it is a very good example of everything that is not quite right at the moment. Which is
and as I think we've already discussed, this last 6-7 months has really exposed all of those cracks and inequalities and issues in the system. We've just got to have a leadership in place to fix the problem, which we don't need to talk about too much. Matt, do you feel like your healthcare is integrated and linked?
Yes, no. Well, I wasn't notified. I mean, I've had sage, I said a few times, and I've had Parkinson's for 45 years. It does affect your ability to shake off diseases which affect your lungs. I wasn't told to shield. But I think from a final point of view, I think the hospital where I'm treated has been perfect with me. Now, I had an operation and I caught COVID myself when I went down the second time. Fortunately, I didn't have it very severely. But now I can have a telemedicine conference, which is super. It means I don't have to travel 3 hours each way to London on the train. It means I can sit at home in a comfortable place, a safe place for me. I can fall off my seat and he'll know what I'm talking about. He'll know what's happened. And it just, I think the bones are there, but I think with AI in itself, I've written down, it's like a dog sled going with a musher, but sometimes for some people, the musher's fallen off. So the dogs are wanting to race away, but there's nobody to control them. And that's how I kind of see it at the moment.
Almost go on, Tina.
I just have to say, I mean, Matt is such a fantastic example and inspiration to all of us to take, to become equipped and take charge of our health. I mean, in the end, that's, nothing can be better than that, to be armed with the information and the knowledge of you as an individual and those that you care about. I mean, that's so important.
It's brilliant. It is brilliant. I'm going to wrap us up, and I'm quite sad. I've enjoyed this.
I have to.
Listen, I think one of the great things about working in the healthcare industry, and it was natural that I was going to end up just going full into it, is it feels like we're never lonely, because there's everybody I meet is doing everything selflessly for the right reasons. And I've actually not met anybody in AI data innovation in healthcare who's doing anything cynically or is doing anything, nefariously. Everyone is doing it for the greater good of everybody else. I think individuals have to take responsibility for their own healthcare. We've discussed that, but and I think you two are two very shining light examples of just brilliant people, lovely people, with very good intentions, doing amazing things. Tina, I cannot wait to read your book. I know it's going to be brilliant. And Matt,
it's available on Amazon, but free to anyone on the NHS.
Anyone on the
NHS workforce.
We're going to get a couple of copies and send them out to people that have been posting questions and stuff. Whoever did the MND question, we'll make sure you get a copy of the book. But anyway, genuinely, for me and everybody else, I think we could talk for hours and hours and hours. But you're a cracking pair of amazing humans, and I love good humans, and you're two very good examples of those. So thank you very much. I've just seen Henry pop back up. Hello.
Well, no, I just want to say thank you. I could listen to you three chat for hours. We can. We'll share links to your book, Tina. We'll have a recording of this session on YouTube hopefully next week.
Matt, are you going to do a book at some point, Matt?
Watch this space. That's all I'm going to say.
Excellent.
And then it'll probably include my wing walk as well.
Oh yeah. So really quickly, I know Henry's going to try and boot us out now. Just really quickly, Matt, do you want to tell everyone what you did last week?
Yes, this time last week I was flying 800 feet in the air at 200 miles an hour, standing on top of a biplane, whizzing around the Gloucestershire countryside. It was wonderful, very liberating.
Amazing example. Disability does not prevent you doing things that you shouldn't do, and
it very nearly did, but it wasn't going to beat me.
I love it.
Do what you love. That's the secret to a long, happy life.
Exactly. Thank you, Tina.
We do that awkward goodbye thing on Zoom now, don't we?
We do. Thanks very much, Pete, Henry, and Tina. Thank you very much.
Great to speak again, Matt. And
thanks, everybody.
yeah. All right.
Bye.
Bye now.